Last week, over the 4th of July break, I spent much of the week traveling in my home state of South Dakota. I think many of my colleagues were in their individual states and probably heard lots from their constituents about what they perceive to be the problems and challenges facing our economy right now. First and foremost is jobs. It's the economy. There's a real concern, I think, about across the country, and rightly so, about which direction the economy is headed and what are the things that Congress ought to properly be focused on. And I think that discussion is always informed, at least with the American people, by a couple of sort of what I would call common sense realizations. One being that you cannot spend money you don't have. That is something I think that the American people get very clearly, largely because that's their reality. They can't spend money they don't have. They have to live within budgets. The same thing is true of many of the small businesses around the country. And I think the second reality is that when you borrow money, someday you have to pay it back. You can't continue to borrow endlessly and continue to rack up more and more and more debt. At some point, there's an end to that. And that's certainly true for family budgets, for small business budgets. The only place that it evidently is not true is here in Washington, D.C., where we continue to borrow and spend and put massive amounts of borrowing and debt upon future generations. Even most state governments, many, mine included, have balanced budget amendments that require them any given year to make sure that the revenues that they take in match up with their expenses. And if they don't do that in my state of South Dakota, they can't go home. The legislature has to stay until the budget is balanced. And so most Americans, as they observe what is happening in Washington these days, are increasingly concerned by the massive amount of spending, the massive amount of borrowing, and frankly, the taxes which they perceive to be in their future as well. One of the things that was very clear to me just in doing parades and public events over the 4th of July break was how much people have picked up on the debate in Washington over the so-called cap-and-trade bill, which in effect is a national energy tax on the American people. It passed in the House a little over a week ago before the break by, I think, a 7-vote margin. There was a big pressure to move it very quickly through the process to try and jam it through. It was over 1,200 pages long. In fact, there was an amendment offered that was 300 pages long. I dare say there weren't many members of the House of Representatives before that bill passed who actually had an opportunity to examine it, to review it, and to study it closely to determine what the ramifications were going to be upon their constituents if the bill passed. And yet it did. It was jammed through. It was a very close vote. At some point here, it's going to be considered by the United States Senate. But the one thing we know at a minimum, and we can debate about how big the cost of that bill is going to be, but we do know that it is going to impose significant increases in costs upon the American public for power, whether that's electricity, whether that's fuels, whether that's natural gas, whether that's home heating oil, the things that the American people depend upon every single day for their very existence. They're going to see the cost of those things go up if this cap-and-trade bill passes. And we've said, we've seen different estimates by different organizations. The most recent one done by the Congressional Budget Office had a several $100 billion impact. And I think if you reduce it down to a per-family cost, it ends up being several $100s a year in increased rates if they're going to pay. Now, I would argue that it's going to be much higher for people in the Midwest, where I come from, because of the way that we derive our power. Most of our power comes from coal-fired power. And that's true not only, and we get a good amount in South Dakota, there are other states around us that can get significantly more from those sources of energy. And so there's going to be significant additional cost imposed upon people in the Midwest, whereas people on the East and West Coast may see their power costs, their energy costs go up, but perhaps by not as much. But this is going to disproportionately impact people in the heartland. Make no mistake about it, and make no mistake about the fact that everybody's electricity costs and fuel costs are going up if this passes. And so the American people are asking the question, okay, if you're going to put a massive new tax on the American people, a new energy tax, what do we get out of it? What kind of benefit do we derive? And I think that there's an increasing concern, questions being raised about whether or not the environmental benefit that would be derived as a result of this massive new tax on energy in this country would be in any way close to the costs that would be associated with it. And I think most Americans have concluded it will not, and I think most of the data bear that out. We know for a fact that other countries in the world are not going to be participating in this system, and that America is going to be unilaterally, essentially, implementing this new regime if it's passed, and that the American consumers are going to be the ones who pay the cost for what I would argue would be very little benefit. Now, there are many ways that you can get reductions in carbon emissions, and we all ought to be looking for ways to reduce the pollutants in the atmosphere, but we can do that through the use of incentives. You can drive investment in certain directions. We could make much more extensive use of nuclear power, which is clean and green energy, and something that we do very little of in this country relative to some of our counterparts in other parts of the world. France, for example, gets 80% of its power, derives 80% of its power from nuclear energy. There is no reason why the United States could not turn to that clean green energy source, as well as renewable energy sources that we have an abundance of in my part of the country, like wind energy. But if you put incentives out there and drive investment in that direction, you can achieve the same end without putting this big top-down government mandate on the American economy at an enormous cost to the American consumers. And that's the issue, I would say, probably as much as anything else that I've heard people talk about, but not far behind it was this notion that that the government is now going to take over 1/6 of our economy because of the legislation that's moving through the Congress right now that would, quote, reform our health care system. And it's, I guess, no surprise to most Americans that we spend a lot on health care. Most of them would like to see us spend less on health care. Many of us think that we can do that we can get costs under control, that we can do it through reforms that preserve what's good about the American health care system, that doesn't copy what's happened in other places around the world, Europe being an example, where care is rationed, where people don't have access to the types of therapies and treatments, and because the government decides what procedures are going to be covered and which procedures are cost-effective. Those are decisions that are made by governments. In this country, those are decisions that are made by patients and by doctors, by physicians, by healthcare providers, and those that they serve. And we believe that's a basic relationship that we ought to preserve when we talk about reforming our healthcare system. But most Americans are very concerned that the government may take over 1/6 of the American economy and run it, imposing the government in the place of, as I said before, what has typically been a relationship between physicians and between patients. And so, Mr. President, what I would argue is that whether it's the issue of new energy taxes on the American consumer, whether it's the issue of the government taking over the healthcare system in this country at a cost of a minimum cost of $1 trillion. Now, there's a CBO, Congressional Budget Office, report that came out recently that says the new plan that the Democrats are unveiling may only be $600 billion, but it also doesn't include many of the most costly parts of the plan that we expect the Democrats to put on the floor of the Senate at some point in the not-too-distant future. But I would simply say again that based upon the feedback that I got from people across this country and people across South Dakota in particular over the break, that the government takeover of health care in this country is something that they are very uncomfortable with, and they don't want to pay trillions of dollars in new taxes to make that possible. And so if you talk about the amount of spending that's going on here, the amount of borrowing that we're doing from future generations, I think most Americans come back to those two basic principles that I mentioned earlier, Mr. President, what I call are sort of common sense conclusions that the American people come to. One is that you cannot spend money that you don't have. And they see Washington doing that every single day. That when you borrow money, you at some point have to pay it back. And there's borrowing going on here right now like there's no tomorrow. The health care entitlement program, if passed, would be minimum of $1 trillion in new spending, either have to be financed by a tax increase, by revenue raisers that the economy is going to pay for at a time when we can least afford it, or by new borrowing at a time when we're already running, over the next decade at least, on average, $1 trillion a year deficits. We cannot continue on this path. It is unsustainable. The American people, I believe, are coming to that realization. And, Mr. President, I hope that the United States Senate will put the brakes on this energy tax, will put the brakes on this massive rush to take over 1/6 of our economy by taking over the health care system in this country. And I believe that as the American people start to weigh into this debate, that those of us here in Washington who are in positions to make some of these policies and shape some of these policies will be getting an earful, and I hope so, because we need to put the brakes on this health care takeover, this massive takeover of the healthcare system in this country. We need to put the brakes on this cap and trade proposal, this new energy tax that will be imposed upon the American people if that's passed in the Senate as it was a week ago in the House of Representatives. I hope that we can stop those things. I hope at least we can bring some sense to this debate about health care that does reform our system, that does get costs under control, but does it in a way that doesn't allow the government to get in the way of making decisions that rightfully ought to be made by patients and by their doctors. And so, Mr. President, with that, I yield the floor and I yield back the balance of my time.